You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of four, Chris Stallman.
This episode contains evidence-based information that's current as of the day recorded and may change as more data becomes available. To get the very latest information about this topic or other topics in pregnancy and breastfeeding, please contact a mother-to-baby specialist at 866-626-6847, by text at 855-999-3525, or through our website at MotherToBaby.org. Welcome to another episode of the Mother to Baby podcast. My name is Chris Stallman, and I'm a genetic counselor, a mom of four, and a teratogen information specialist. So what I do is I talk to people, patients, family members, healthcare providers about exposures that can happen before pregnancy, during breastfeeding, and in cases of adoption. And an exposure can be anything. So it could be a chemical that you work with, it could be a medication, it could be a vaccine, or anything in between. On today's show, we are lucky enough to be able to talk with an organization that partners with Mother to Baby and their experts. Lisa Bain is the director for Global Communities US and Border Programs. She has 20 years experience designing, implementing, and evaluating health programs to achieve health equity, including Global Communities Healthy Start program, which has been serving San Diego communities since 2007. Lisa, welcome to the show.
Thank you, Chris. It's great to be here.
So let's get started. Can you tell us a little bit about Healthy Start?
Sure, I'd be happy to. And let me also add that I'm also a mom of two. My littles are 8 and 11 now, but they brought me so much joy, and I'm extremely fortunate that my Healthy Start journey started with the birth of my own children. So Healthy Start's actually a national initiative. This is the federal government's initiative to address disparities in birth outcomes. In particular, why do some communities experience higher rates of infant mortality, maternal mortality, low birth weight, preterm birth weight? We know the United States is not doing as well as other developed nations with regard to those outcomes. And then we know within the United States, communities have significantly higher rates of those troublesome areas. And so that this is the federal government's initiative to say, hey, we have to do something about this. We're going to invest resources where they are needed most to change those disparities and to create improvements. So that is Healthy Start at the national level.
So tell us about the communities that Healthy Start supports.
Sure. So there are actually 101 Healthy Start programs currently working across the nation. We are just one of those. Every community has gotten to identify which populations need that support. In some places, that might be a Native American tribe. In other places, it could be low-income Medi-Cal families. Here in San Diego, we see that the disparities are greatest primarily for Black communities in San Diego County. And so our program currently focuses on Black communities. But in San Diego, those are very diverse. Black doesn't only mean African American, it can also mean Black immigrants. We have a very large and long-standing East African community, for example, Somalis, Ethiopians. We also have a recent influx of Haitian asylum seekers, and those communities also are ones that we work with and try to bring services that they wouldn't get otherwise, right? And I just want to take a minute to emphasize that our Healthy Start program, we provide free prenatal and childbirth education, postpartum and breastfeeding support. And we do that from pregnancy until a baby turns about 18 months. And we are doing direct health education, but also connecting our clients to free midwifery services, lactation services, doula services, mental health services. And it's so important because if you're like me, a middle-class white woman who speaks native English, I have good availability to those services. I can go and get childbirth education in my language, which I can afford, and I can get there. However, if you are from a different background, you may have significantly more challenges, right? Even finding language appropriate care, or finding a group that is comfortable for you to participate in, where there are other people who you share a background with. So those are some of the things our particular Healthy Start is trying to address.
Excellent. One of the programs Healthy Start supports is a breastfeeding program through a nonprofit called Global Communities. And to talk more about Global Communities, we have Chardá Bell. She is an international board-certified lactation consultant, doula, and birth educator who oversees Global Communities' U.S.-based lactation equity programs, including implementing a weekly breastfeeding support group and supporting a multilingual breastfeeding warm line. She also has a private practice called Melanin Milk and is a proud blended family mother of 5. Chardá, welcome to the show. Chardá, can you tell us about the lactation program that you run?
Just as you said, Chris, we have a weekly breastfeeding support group that we do every Tuesday from 11 to 12. And we also are going to be implementing another support group out of demand for just the want for parents to have a place to gather in Southeast San Diego, which is known as a geographical first food desert. And so we started this program with the hope to increase, or the goal rather, to increase low breastfeeding rates in the Black community within Southeast San Diego and San Diego County in general. And, you know, breast milk is a first food, so there's a lack of support for Black communities with regards to lactation support. And so we wanted to create that in the space where it needed it.
So let's switch gears and talk a little bit about the challenges that the area in California you serve faces when it comes to breastfeeding. What are some of those big challenges for people in a lower socioeconomic community?
I'd say, you know, workplace constraints is a big one. Just having lack of breastfeeding policies within the workplace, little to no access to lactation support, which we are now providing here in San Diego, in Southeast San Diego. I'd also say food insecurity, which kind of goes hand in hand with that geographical first food desert that we talked about. So just not having adequate nutritious foods within your reach, where you don't have to get in a car and drive a very long ways to get there. I know in Southeast is where I am from, we don't have Whole Foods markets or anything close to us in that area. The closest for Whole Foods, I think, is in Hillcrest, and then there's another one in La Jolla. We should have a Whole Foods in Southeast San Diego. There's no reason that we shouldn't. So just thinking about it from that lens, we don't have easy access in those areas, in those communities and neighborhoods to get the food that we need. And food is an important part of, you know, breastfeeding and nourishment, and being, you know, making sure you're well nourished so that you can nourish your baby. So I'd say that, also just social and cultural support. So that is another reason why we started this breastfeeding support group. I used to be a volunteer for the La Leche League, and what I noticed was that there were little to no Black people who come to La Leche League meetings. And when I started asking, like, why people were not coming, I think I met one couple that was Black, and they were at a support group, and they told me, you know, a lot of our friends and family have told us they just don't feel comfortable in this space. They needed the support, so they went, even though that may not have been the most comfortable place for them. They needed support, so they went. But they should be able to get support where they're comfortable and they feel like they can see themselves in that person, and vice versa. And so that's really what we try to create with this lactation program, is just making sure that we are driving that pipeline for perinatal workforce development to include diversity in lactation support, so that we can have more Black lactation consultants and lactation educators and counselors that look like the community that they're serving, and be able to reciprocate that.
And are you getting a good uptake of your services for the target communities?
Yes, we are. We're seeing, I was surprised that there were people. I think our first support group, someone told me that she walked there because it was that close, so that was really cool.
Nice.
And just knowing that she could go to a support group now every week, whereas before she would have had to go somewhere much further out, and maybe that was not as convenient for her, and then she just wouldn't do it. And so just bringing that access into the community, it has been great. We had a recent move of locations, and we moved yesterday, so we had our first support group in our new location, and it was full. And I was like, oh my gosh, people are still coming even though we moved, so they know. And we haven't been doing it too long, but yeah, we do have a lot of community members that come and have been even asking for like private consults and going deeper into their breastfeeding journey to get the support that they need.
I'm glad to hear that. I'm sure moving is hard for sure, but I'm glad to hear that folks are still seeking it out, and even with your new location. So best of luck in the new location.
Thank you.
What are some common questions you get about exposures in breastfeeding?
At the breastfeeding support group, I'd say we get a lot of questions around cannabis lately. We get questions about COVID still. In private practice, I get a little bit of everything from nicotine, vaping, the difference between e-cigarettes and regular cigarettes, prescription drugs, a lot of steroids, arthritis type medications after, postpartum. A lot of moms tend to get, I forget what the doctors are calling it now, like mommy wrist or something like that. One of my clients told me, but we're getting that. I'd say antidepressants, mushrooms. I think I got that question once or twice as well.
Sounds very consistent with what we get at MotherToBaby. Do you get supplement questions? So like not just pills, but like, there's berberine recently and like protein shakes and stuff like that all the time.
Yes. CMOS is the one people have been like, I guess it's been all the rave on TikTok. So, they're asking about all these. TikTok has been the battle with the exposures because we're seeing a lot more like, I do this and I do that. And it's like, well, that's what, you do. But so I say, you have to look at it. You have to ask questions. So I do give a MotherToBaby a lot as a resource. And that has been very valuable. And even here in the Southeast Breastfeeding Clinic, we have the MotherToBaby handout. So when we get those exposure questions, we give them a little bit of knowledge, and then we tell them to follow up with going online and doing the chat or something like that.
I think you make such a great point about TikTok, social media. Yes. So one of the ones that we've been getting recently is berberine, because they call it nature's Ozempic. So like, for weight loss and stuff like that. So yes, a great reminder for everybody out there. Please know your source of information, and always, talk with your healthcare provider or a lactation consultant if you can. So what tips do you have for people who may benefit from Healthy Start services in other parts of the country, and that support breastfeeding programs like the one you're leading?
I'd say, research available programs in your area, attend groups, create groups if you need to create that for yourself if it's not there, kind of like what we did. Find your lactation consultants in the community, ask around, talk to birth centers and birth workers to find one if you need to do that, and advocating for more breastfeeding friendly policies as well.
So Lisa and Chardá, thank you so much for being with us today. But before we let you go, what is a final thought that each of you would like to leave our audience with?
Thank you, Chris. I wanted to point out a detail, which is that some of these disparities, many of these disparities, go far beyond income. They're present regardless of income status. Yes, low-income families face certain barriers, but other communities experience that regardless of income. And so our programs do take that into account, but go far beyond. And actually, you all know, because you're all moms, it's hard to be a new parent, regardless, right? Regardless of your gender, regardless of your income, it can be very challenging. Breastfeeding in particular, lactation, can be very overwhelming for a lot of families, and everybody deserves this support. Everybody should be able to access it. regardless of income, regardless of language, regardless of background. And so we feel so excited about the work we're doing, which is bringing our services to communities who don't otherwise get it. And I would just encourage everybody to reach out to clinicians like Chardá on their breastfeeding journey, or connect people, services like Healthy Start, other breastfeeding support groups across the nation, so that all families can get the care they need, regardless of income or background.
I think Lisa took the words from my mouth and what I was going to say. I'd like to say, every breastfeeding journey is unique. Every infant feeding journey is unique. And I think seeking support is the most critical point of determining how things will go for you. And so there's programs like Healthy Start, and like our lactation program that we have at Global Community that can significantly enhance, your breastfeeding journey, your chest feeding journey or experience. And, we're doing this so that we can see breastfeeding success rates go up in our affected communities, and to help us decrease disparities.
And we will have information on how to connect with the programs mentioned in the show notes for the podcast. Again, Chardá and Lisa, thank you so much for being with us today.
Thank you.
And that's going to do it for this episode of the Mother to Baby podcast. If you have an idea for the show, or if you want to be on the show, we want to hear from you. So please feel free to email us at contactus@mothertobaby.org. Remember to hit that subscribe button so that way you never miss a new episode of the podcast, or you can go back and listen to older episodes as well. You can find us on iTunes, Spotify, Audible, and however else you listen to podcasts. And don't forget, Mother to Baby is here to answer your questions about exposures before pregnancy, during breastfeeding, or in cases of adoption. You can reach us by phone at 866-626-6847, by text at 855-999-3525, on our website at mothertobaby.org. There you can chat with a specialist. You can also email us. You can look for our podcasts, our baby blogs, our information pages, our many, many fact sheets in English and in Spanish, all free. And you can also find out more about the Mother to Baby pregnancy studies and how you can participate. So until next time, remember, Mother to Baby is here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Service Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.